basic physiological exam for module 1. All right, first step is to check for energy efficiency. Okay, relax your legs down. Great. Then we have protein utilization, pinching the hair at the base of the scalp. Okay, body fluids, which is the second rib interspace, 5 fingers in the mid-axillary line. Great. Next we're going, does this body need water metabolism? No. Okay, for water utilization, contact the liver point, and then the pancreas, here for just 1 second, is tip of the xiphoid, 5th rib interspace, and we go down 1 inch, or down 1 rib interspace to the midclavicular lines, pancreas point. All right, will you take your hand all the way up? Great, bring it back. Okay. All right, the next we have is costal torsion. We are just checking the inferior margin of the ribs here. Let's check to see if there's any torque pattern. Great. Anterior thoracics, 3 pinches along the sternum. Diaphragmatic reset. Okay, hiatal hernia, which is 2 inches from the tip of the xiphoid. Slight pressure up and in. All right, next we have hepatic flexure, which is positive. Okay, so check for outward. Outward, okay. All right, just breathe in and out. Just doing some manual. Okay, all right, then massage from under the rib down to where the ascending and transverse colon meet. Okay, now we can recheck it. Great. We have the ileocephal valve, so the halfway point between the acetabulum and the ilium, and then the rib halfway here. Okay. The mirror image for valves of Houston. All right, then we're going to do splenic flexure, which is also positive. Away. Okay. Nice manual pressure here. And then we're going to massage down. Okay. Check that. Great. Next we are going to do PMS, menopause, andropause. Great. We have autoimmune switch. Got a knife edge. Great. Flex your body here. Then we have sex 2. Great. It's negative. Buccinator. Okay. Let's check for jaw laterality. Just palpating the jaw to see if either side is lateral. Alright, now you're lateral on the right. Okay, is that comfortable? Breathe in and out, and in, and out, and in, and out. Nice. Feels a lot more even. Alright, we're going to check for temporal bulge. I'm going to walk you through a breath cycle. I'll instruct you to finish your current breath cycle, and I'll have you breathe in, and I'll tell you to stop and pause your breath, and then to finish breathing in, and then I'll instruct you to breathe out, and then pause your breath, and then I'll tell you when to finish breathing in. Okay? Alright, so finish your breath cycle. Okay, alright, breathe in, stop, breathe out, or sorry, let's do that again. Alright, so finish breathing out, thanks. Alright, so I'll have you breathe in, stop. Okay, finish breathing in. Okay, breathe out, stop. Okay, finish breathing out. Great, you can relax your arm. That was negative, so I'm going to have you flip over. The prone part of the exam. So the first thing that we're going to test here is inferior occiput. So I'm palpating the inferior angle of margin of the occiput and under. Those are even. Okay, we're gonna check bilateral hamstrings. Nice. Okay, check here. All right, the next thing I'm going to have you do is place a hand on your sex 1 point, which is the second rib closest to the cortico process in the lung fossa. Okay, have you hold that here. Test. Great. You can relax. The next test from here I'm going to have you do is tail wag. So yeah, put your fingers down vertical on your forehead. Thank you. For this one, I'm going to be palpating your coccyx. It can be a little bit uncomfortable. Okay. All right. I'm going to test here. Each direction. Okay. All right. You can relax. All right. Will you put your 2 hands on top of each other over your pubic bone? I'm going to place the carrier seeds on the sex 2 points on the forehead. Okay, thank you. And again, we are going to palpate the coccyx. Okay, so the anterior, posterior, right and left. It's negative, great. Let's take off the carrier seeds. Okay. You can take one hand off, use the other one to cover your entire genital opening. Turn your head if you'd like. This is reproductive dysbiosis. Great. That is negative. You can take your hands off. All right, relax a little bit. The next test is chronic nagging low back pain. Slide your knees together, flex your feet. I'm going to have you resist here. Okay, great. So I'm going to have you relax your legs out like this, and I'm going to correct sacral base. So I'm going to apply pressure here. Breathe in and out. And in and out. And in and out. And one more. Okay, great. Now this next one is inhalation allergy. Okay, we're just checking for leg length and equality. That is negative. I can have you sit up now with the upright portion of your exam. Okay, let me just double check that we can see you. Great. All right, so the very first test for this is ocular hypertension. Okay, we have corpus callosum, which is positive. Recheck for corpus callosum. Okay, it's positive. We do have to hold this point. Going to contact C4. Breathe in and out. T4. T3, T4. Breathe in and out. And T8. So inferior angle of the scapula. Down one interspace, or down one spinous process. Breathe in and out for T8, and T4 is along the spine of the scapula, gives you T3, and then down one spinous process. All right, test for corpus callosum again. All right, we have thalamus. So keep your eyes open. Hypothalamus. Will you close your eyes? Great. Okay, you can open it. Free radicals, pineal, pituitary. Give me a yes, give me a no. Okay, free radicals, pineal, pituitary, DNA repair. All right, cerebral spinal fluid tension, apply pressure on the mastoids bilaterally, carotids. Okay, we have parathyroid, thyroid. check a 60-40 for that. All right, bone marrow is positive as well. Okay, this is gonna be L5, breathe in and out. Okay, all right, we have bone marrow. Now we have microbiota, which is first rib, second, third rib, 3 fingers, fourth rib inner space, 3 fingers, that's strong. Okay, we have microbiota. We have lungs, which is the second rib head, lungs, emotional respiration, bronchi, tracheal. Alright, then I have spores, which is the 4th rib head, which is positive. Just rub that. Might be a little sore from this. Okay. Great. And thymus. Okay. Spores, thymus, and we have cardiac brain, which is 1, 2, 3, 4th. Just lateral of the 4th. So in the 4th rib inner space, just lateral of the sternum. Tap. Okay. That's negative. We have circulation. Circulation is positive. Direction for this is T2, breathe in and out. T8, breathe in and out. And T12, breathe in and out. Okay, so we check that. Circulation, okay. Arterial circulation, which is positive. Breathe in and out. T2, T8, breathe in and out. And T12, breathe in and out. Okay, great. So for our arterial circulation, okay, and we have venous circulation. Okay, and we have autoimmune suppressed, which is thymus, circulation, pineal, corpus callosum. Okay, we're going to correct T4, breathe in and out. C4, T4. Corrected the right one, called it out wrong. Okay, T8, breathe in and out. Alright. So autoimmune suppressed, thymus, circulation, pineal, corpus callosum. Alright, then we have endocardium, pericardium, which is an inch above the tip of the xiphoid, heart. Okay. I'm going to have you put your finger on the heart point, which is just right here. And I'm going to do T2 spinous process. So T3, T2. Actually, I'm going to have you switch. Thank you. Okay. Great. Blood pressure ratio is negative. Next, we have virus, kidney, which is positive. Alright, it's T1, breathe in and out. T5, breathe in and out. T8, breathe in and out. Okay. So virus, kidney. Okay. Then we're going to do spleen. So we go to the tip of the xiphoid, over to the 5th rib inner space, down an inner space to the 6th rib inner space. Okay. And a mid-clavicular line and 1 inch lateral is the spleen point. Strong. Okay. Mid-clavicular line, same rib inner space is pancreas. 1 inch lateral up to that is the stomach point. We're connecting the stomach and the hiatal hernia point, which is 2 inches below the tip of the xiphoid for pyloric sphincter, sphincter of Oddi, head of pancreas. Okay. We're going to do benzodiazepine exposure. Okay. Okay, which is here, strong, negative, cannabis. Okay, we're gonna do gallbladder. So over to the 5th rib inner space, down to the 6th rib inner space, 1 inch lateral, right? And liver. Liver is T2, breathe in and out. T5, breathe in and out. T8, breathe in and out. Okay, got liver. Right, after liver, we have bacteria 1. For that, this is the 9th rib head. Right virus, right kidney. All right, we've got yeast, mold, yeast. All right, now we've got ascending colon. Give me yes, give me no. Okay, ascending colon, transverse colon, descending colon, sigmoid colon. Correction for this is L5. Breathe in and out. All right, descending colon. Now we have the jejunum. Okay, duodenum, and we have small intestines, which is positive, and you do have to hold this point, which is also L5. Breathe in and out. Okay. Small intestines. We have uterer, ovary on the left, bladder, right ovary, uterer here. We have common integument in reverse. Regular common integument. Great. Okay, now let's do need and use. All right, for need and use, first one we are going to do is calcium. So it's on the left side of the body, 1 inch lateral of the clavicular knob. Hold strong, okay. It's negative, another inch lateral into the soft tissue is vitamin E. It's negative. 5 fingers on the vitamin E, the tocopherol point is omega fatty acids. Okay, it's also negative. We're going to check minerals, which on the right side, 1 inch lateral of the midclavicular knob. Okay, we're going to check for cobalamin. Okay, heart point finished. Okay, cobalamin is negative. Now we have pyridoxine, which is on the right side of the body, 1 inch down from the tip of the xiphoid, the xiphosternal junction, kind of on the inferior angle of the inferior margin of the rib. Okay, so pyridoxine finished. Okay, then we go down 1 more inch, and this is the acidophilus point. This is positive. Okay, I'm gonna have you hold that. All right, we've got acidophilus, which is florinor. Okay, right, so weak. Okay, all right, surge protocol. Okay, 0 a day, 1 a day. Can this body use 1 a day? Finished. Okay, all right, so 1 a day for florinor. Okay, we're finished. Okay, finished with the antioxidant point. You can relax and release your hand here. The next one is the hydrochloric acid, and that is 1 inch down on the left side from the xiphoid in the inferior margin of the rib. Hold strong. Okay, antioxidants is also negative. You don't take pumpkin seed oil because you're a female, but let's take the cholecalciferol. Okay, this here. Finished. Say 0 a day, 1 a day. Can this body use 1 a day? Currently, you're taking 10,000 IUs of vitamin D. Anyway, so great. Myra will just ask, finished? Finished? Okay. All right, I'm gonna have you hold this up. Finish with topical disinfectant. Okay. Let's just see, 0 times a day. Finish with topical disinfectant. Great. Off your arm. Next we have, does this body need vision home care? Okay. All right, well, I'm gonna have you lay down and go all the way through the exam. Let's just get you close up, drain, 2, 3, okay, strong. All right, poison, toxicity, all right, category 4. All right, I'm gonna have you take a deep breath in and out. All right, for category 4, I'm applying pressure on the PSIS and the ischial tuberosity. Take one more deep breath.